The residency program here dates back over 60 years, and actually Homer Stryker had residents back in the 1960s, and that program has grown and developed over time and now has become what we have here today. We have an excellent group of really strong faculty. They're subspecialty trained in all of the different areas of orthopedic surgery, and they're really dedicated to teaching our residents and making sure that they are successful. They care about each resident as an individual person, and they really want to make sure that they're set up to be productive in fellowship and in practice. Our residents spend time at both hospitals here in town, so that's Borges Medical Center and Bronson Methodist Hospital. Bronson is a level 1 trauma center for both adults and children. It's the only one in Southwest Michigan. And we also have a busy level 2 trauma center at Borges. Residents also have the opportunity to see patients in outpatient clinics throughout the city, including here at the medical school, and to operate at the surgery center of Kalamazoo. We're a fairly small group, like 3 residents a year, and really the residents feel like this is a family. And so they look out for each other, and they're making sure that the people in more senior roles are helping the people in more junior roles succeed. There's also a more formal coaching program where residents are assigned a coach to help them kind of develop their own learning plan and succeed in residency. And then true mentorship kind of grows organically, and so our residents will identify someone, usually in the subspecialty that they're interested in, who will help serve as their mentor over time. Our residents are really well prepared to do whatever they would like to do. So we have residents who choose to go on and do fellowships in all the different subspecialties, and they match at some of the top programs in the country, typically at their first choices. We also have residents whose goal is to go back home, often to a more rural area, and be able to work as a general orthopedic surgeon there, and they're comfortable doing that right out of residency here. Universally, it's the people. I think that's one of the biggest strengths of our program. Our current residents are amazing people. They're really engaged in the program. They like to teach. And the same goes for our faculty. And we have really good relationships between the residents and faculty. I think the residents would tell you that they feel very comfortable approaching the faculty if they have a question or a concern about a patient or want to talk about preoperative plans for the cases coming up this week, as well as for those kind of mentoring conversations for how to plan for life after residency, and get ready for your fellowship or your job, and sometimes just for family life and other things that happen. Kalamazoo is a really comfortable place to live. It's not overly large or so busy that you're stuck in traffic all the time, but we have a lot more resources than you might expect for a town of this size. Part of that has to do with the colleges and universities that are here, so there's a lot of opportunities to take part in both college sports and professional sports. There are a lot of arts and culture offerings in town, and we have a lot of great restaurants and breweries and other places to go and enjoy. It's also a great place to enjoy the outdoors, so if you like to run or bike or mountain bike or enjoy being on lakes or rivers, we have tons of opportunities for that as well.